Scoliosis screenings. How to identify scoliosis early. Scoliosis is the development of an unnatural sideways spinal curvature. Scoliosis curves always rotate, and they typically rotate into the concavity of the scoliosis. This rotational component of scoliosis makes it a three-dimensional condition. The curve has to be a minimum size to be diagnosed as a scoliosis, and the Cobb angle measurement has to be at least 10 degrees or greater with rotation to be considered scoliosis. A Cobb angle is a measurement taken during an X-ray. When the spine is in a healthy position, every vertebra is aligned completely above and below, and then from straight in one alignment, and also from the side, there's curvatures, but these curvatures are normally from the side. When a patient has a scoliosis, these unnatural curvatures occur from the front, and this causes a misalignment of the spine. A patient's Cobb angle tells me how far out of alignment the scoliotic spine is, or how severe the condition is. And this classification upon severity helps us determine how noticeable the scoliosis probably will be and how more likely it will progress over time. The severity of scoliosis are broken down into significant categories. We like to use 4 specific categories, and the higher the Cobb angle, the more severe the condition. Mild scoliosis curves are between 10 and 25 degrees. This is where it's kind of diagnosed as a mild scoliosis. Moderate scoliosis are between 25 and 40 degrees, and severe scoliosis is 40 degrees or greater. Now, the moderate to severe transition is sometimes considered to be at 40, sometimes it's considered to be at 45, but it's around this 40 to 45 degree range. I like to use a last severity component, and that's called very severe scoliosis. This is this last component or classification of scoliosis, and this is where I say curves are 80 plus degrees. Now, the more severe the condition, the more likely it's going to be more noticeable, and the likely it's going to lead to more complications as a result of surgery. Now, early detection, particularly in mild cases, can sometimes be challenging because sometimes what you see is very subtle, and the very subtle things that you see or the person's experiencing, they may not be much different than they compare to somebody else, and they're only somebody who's expert in scoliosis or deals with scoliosis every day can actually detect it. Now, in children, what are some early signs to watch for if you want to screen your children for scoliosis? Well, first thing is scoliosis introduces uneven forces to the body, which can disrupt its overall symmetry. So the main symptom of scoliosis in children is posture deviation. Normally, children do not experience pain, do not experience malfunction, do not experience anything that's going to tell you that something is wrong other than posture deviation. Only 5% of children actually experience pain as a result of scoliosis, and very often the pain is considered to be mild at the site of curve that's relieved with rest. A lot of children participate in sports, and sometimes kids that play sports can have mild, dull aches as a result, and that are relieved with rest. So a lot of times we don't think it's much different than a child that's participating in some kind of sport or activity. But if you see any type of postural deviation, there's never a normal posture deviation in children during growth. I would never consider any type of uneven shoulders, uneven hips, flat waist, anything like that, development of a rib arch, arms that don't appear to be hanging the same symmetry to the body, changes in gait, balance, coordination can also be common in scoliosis cases. But when we see this type of asymmetry, meaning any type of physical asymmetry in a patient, we are concerned about scoliosis. In adults, the main symptom that brings up the diagnosis is pain, not postural asymmetry. So scoliosis becomes compressive in the adult stage, and it's this compression that makes the spine and the surrounding tissues to become vulnerable to this compressive nature of scoliosis, which can lead to pain and problems. Compression as a result of uneven pressure is the main thing that causes pain, which is the main reason why scoliosis is treated in the adult stage. The most common, it's going to be low back pain. It's going to be radiating down into the lower legs are the main symptoms. Typically, it's on the left side and the left leg, but it can be either side. Now, in the adult patient, if you're experiencing pain and you knew you had scoliosis as the adolescent, and people are disregarding the scoliosis or not checking it, and they're just treating you for your whatever you're feeling, get your spine evaluated, because if you have a scoliosis, it could be progressing in the adult stage, because progression in the adult stage is associated with pain, not in the adolescent stage. So how do we diagnose scoliosis early in children when we're screening for it? Now, understanding that scoliosis screenings in school systems, they're different in every single state, the way they're done. And the way school screenings are typically done, they're normally done at one age. I mean, they're done at one time. Now, when these screenings are performed in schools, they're typically done at let's say everybody's 11 or 12 years old. The problem is kids go through growth spurts at different ages. So if you catch somebody pre-growth, they may have a little scoliosis that's not being detectable, and then they have the growth spurt after the screening and they get missed. So you can't screen everybody at the exact same age because it's based upon when they grow. We know girls go through earlier growth spurts than boys, so boys can often not get diagnosed. If we're screening kids at 11, they may have gone through the growth spurt because most boys go through growth spurts around 12 to 13. So if they haven't gone through a growth spurt, they could have a small curve that never gets diagnosed, and like a school screening. So the best way is to have your child professionally examined by a specialist that involves looking at their posture, looking at their gait, and they can tell a lot about the spine based upon the way they walk and the way they move and the way they stand. In addition, a history. If there's a history of scoliosis in the family, there's more likely to become another person with scoliosis. Even though we know scoliosis isn't genetically caused, they've done studies on identical twins and they don't find every case of identical twins that both have scoliosis, but we know it's familiar. I mean, if one person has scoliosis, it's more likely to have another scoliosis. So if you have one child that has scoliosis, it's more likely to have another one. If you have scoliosis in your children and you're looking at your children, they're more likely to develop scoliosis. We don't know exactly the genetic components of how that happened, but we definitely want to be looking. If you have any posture asymmetry or if you have any family history of scoliosis, then the next thing you should be looking for is something called Adam's test. This is where you bend forward and you're looking at the spine. Now, you're not looking at just the rib arching, you're looking at the lumbar spine. And normally we like to use something called a ScoliMeter, which is a combination of like a ruler and level that can measure very subtle changes in rotation, which gives us a baseline. It's easier to detect. A ScoliMeter makes an Adam test more sensitive to find scoliosis. If you just have people bend forward and they just look at the rib cage, they don't look at the lumbar spine, they can miss lumbar curves. So if we have a positive Adams test or a positive ScoliMeter test, the next thing we do is we recommend a Scoliosis X-Ray. And X-rays help us determine exactly where scoliosis is. Now, sometimes posture could be hard to see, depending on the presentation of the person. Meaning patients that have certain body types, posture could be a little more difficult to actually examine than other patients. So if there's a history of scoliosis and you're just looking at posture, but we're not doing a forward bending test with a ScoliMeter, you could miss it. So sometimes if there's just a family history and you want to suspect it, and you're seeing some asymmetry but it doesn't look very significant, in patients with certain body types, big curves can hide themselves. So maybe you want to take an X-ray anyway, just to make sure that there's nothing going on. So there's never any guarantees, but we definitely know that if you treat curves early while they're being detected and early in adolescence, that conservative intervention does increase the likelihood of the success of treatment, meaning that they're more or less likely to progress into more surgical or more severe levels. As curves progress, scoliosis is always more difficult to treat. And we know scoliosis is a progressive condition, so we know it worsens over time. We just don't know how fast it's going to worsen. They could worsen rapidly during adolescence, they can worsen slowly during the adult stage, and they can start progressing relatively quickly again in later stage life. So we know scoliosis has a progressive nature to it, so therefore being as proactive as possible typically leads to the best outcome. So the sooner we treat curves to the time of diagnosis, the more likely we are to get a positive outcome, and the simpler it is to treat over time, especially because we know the progressive nature of scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.